Hi, my name is Min Lam,
And I'm Liz Catlin.
and today we are going to be measuring the extension of the first MTP joint, also called the first ray. This joint is going to be between the first metatarsal and the proximal phalanx of the first toe. So this joint right here. This extension motion occurs in the sagittal plane through the medial-lateral axis. This measurement is indicated when a patient is suspected of having decreased push-off during gait, but this test is contraindicated when there is an open wound present in the area being measured, if there is an amputation, or if there is a physician-ordered movement restriction on the great toe.
A study by Jones and Curran in 2012 found that experienced examiners showed excellent intra- and inter-rater reliability for goniometry of first MTP extension. Inexperienced examiners demonstrated fair to good intra- and inter-rater reliability. This study supports the use of goniometry for first MTP extension.
So we want to measure active range of motion and then passive range of motion of the first MTP joint extension. Have the patient in sitting or supine position with the ankle at 0 degrees of dorsiflexion, plantar flexion, eversion, and inversion, and place the IP joint at 0 degrees of flexion and extension. Basically, we want a neutral foot.
The therapist should stabilize the first metatarsal to prevent ankle motion. For active range of motion, we'll have the patient extend the great toe as far as possible. The landmarks for goniometric measurement are the fulcrum over the dorsal aspect of the first MTP joint, the stationary arm over the dorsal midline of the first metatarsal, and the movable arm over the dorsal midline of the proximal phalanx. For passive range of motion, stabilize the first metatarsal and push the proximal phalanx towards the dorsum of the foot. Do not push on the distal phalanx because that will cause IP extension and will cause passive insufficiency of the flexor hallucis longus and active insufficiency of the extensor hallucis longus. The end feel of the movement is firm because of tension in the plantar joint capsule. Measure this angle with the goniometer using the same landmarks as mentioned previously. The normal range of motion of first MTP extension is between 50 and 70 degrees. A study by Glasgow et al. In 1999 found that approximately 65 degrees of first MTP extension is required for push-off during gait. Now we will demonstrate how to perform this measurement on a patient.
Hi, my name is Min Lam, and I'm going to be your physical therapist. How are you doing today?
I'm good. How are you doing?
I'm good. So what I want to do today is take a measurement of your foot. So if you can you please take off your shoes and your socks?
Sure.
And I just want you to sit at the edge of the table like you are right now, and I'm going to raise the table to an appropriate height to take the measurement.
Sure.
And then I'll take your right leg. So the first thing I want to do is put your foot in neutral, like so. And I'm going to show you the motion that I want, which is to bend your big toe toward your leg. And then I'm going to have you perform that motion by yourself, and I'll take my first measurement. And then I'm going to have you relax, and I'll put you through that motion, and I'll take a second measurement. So I'm going to stabilize you here on your first metatarsal, and bend your big toe toward your leg, like so. And do you feel this motion?
I do.
So can you perform that by yourself? Good. Now go ahead and relax. And I'm going to check your passive range of motion really quickly. Good. Now, I want you to perform that motion, and I'm going to take my first measurement. So whenever you're ready, go ahead and bend your big toe toward your leg.
All right.
Okay. Good. And the fulcrum of the goni is going to be on your joint. The stationary arm is going to be on the dorsum side of your first metatarsal. And the movable arm is going to be on the dorsum side of your proximal phalanx. And I am getting 68 degrees. So go ahead and relax. And now I'm going to take my second measurement and put you through that motion again. And I'm going to use the same landmarks. And your passive range of motion is 70 degrees. So for that patient, I would document it as right MTP extension, active range of motion 0 to 68 degrees, and passive range of motion 0 to 70 degrees.
And so that's how you do goniometry for first MTP extension. Thanks for watching.